Okay, here's a video of a meniscal repair with an ACL reconstruction. This is the medial meniscus tear on the undersurface. The rest of the meniscus and the cartilage on the ends of the bone all look okay. This is called an all-inside meniscal repair. So this suture will go in and penetrate both sides of the tear on the back of the meniscus. The first pass goes through, and then the suture balls up on the back to create an anchor. We come back, and the second pass goes through both ends of the tear. And we're extra careful on these to make sure we don't scratch the ends of the bone or that cartilage, as it really doesn't have the capacity to regenerate. And the second pass is in. You remove the needle and then tension the stitch that pulls the two sides together. And then trim the edge. We'll repeat that process for this tear. It only required 2 stitches. And we'll do some fancy work to untangle the knot that I made. Tension the repair and trim the edge. Now we'll move into the intercondylar notch after we probe the repair. And this is the remnant of the ACL tear that previously was attached to the side of the bone where my probe is. But you can see it's pulled over and balled up on the edge. As this was not a repairable tear, we debrided the torn ligament to make room for the graft that will become the new ACL. This is the fat pad that we're removing for visualization. And right behind the shaver to the left is the PCL. And we'll remove all of the fibers that are left attached to the wall. And this helps to visualize so we can put the tunnel for the new graft exactly where we want it to be. This is the lateral compartment with a normal lateral meniscus and healthy looking cartilage. Now in this patient, the notch was very narrow, which may have contributed to the ACL tear in the first place. So in order to prevent that from happening again, or at least to minimize the risk of it happening again, we'll widen the notch with a burr. This is called a notchplasty. Once we clear it of remaining cartilage, then we can visualize exactly where we want to put the tunnel for the new graft. Now this is almost an aiming arm. It's a guide that's going to help us put our drill hole exactly where we want it. And once we drill, we deploy the flip cutter, which will backwards ream and create a socket that the graft will eventually dock in. So once the socket is created, we pass sutures that will be pull stitches to shuttle the graft through into the tunnel. And this is a peek up inside the socket, seeing the thicker part down below and then it narrowing up top. The same steps are carried out for the tibial tunnel, showing the position. This is right where the stump of the previous ACL attached. We'll then remove the aiming arm deploy the flip cut, and we cut these tunnels to be the size of the graft, which has already been prepared on the back table. We want a snug fit of the graft into the bone tunnel. Here we are creating the socket. And just like on the other side, once this is pulled through, the shuttle sutures are passed and pulled out of the knee. Now that our tunnels are prepped, we can begin passing the graft. And these are the stitches on the graft that goes up into the socket. And then we slowly pull the graft into the socket. Once the femoral side is docked, we will dunk the graft into the tibial tunnel and secure this with a button on the outside of the knee. We'll then retension the femoral side. And once we get the appropriate tension, we can go back in and visualize our work. This is the new ACL that about 30 minutes ago was part of the quadricep tendon. It's nice and tight. It's filled the sockets well. And when we bring the knee through a range of motion, you can see that there's no bony impingement. So nothing's going to be kinking it or rubbing against it. And over time, this will heal to become a new ACL.